Now we had this inquiry in terms of a bit of help from somebody who's got a plasma device, I assume, and so we'll try to help her out a bit. Let's have a look, see what she says. So my name is Pierina. I'm following you from Miami. I really love your online trainings. I have a client with this type of scars. I just made a patch test last Saturday to see the reaction, but I would like to know if I'm right with my hypothesis. I'm thinking to try the outer borders of the scar lines, but I'm thinking to treat the inside scars that are hypertrophic. She has some areas like that, so I'm just correcting as I go along. Let's have a look at the pictures now. These look like surgical pictures from I would assume a surgical picture, probably due to maybe something serious, because it's covering the not only the breast, which looks like breast implants, but it's just the underarm. So I suspect something went not really right there. It was not just a classic. It's not just a classic surgery for aesthetic reasons only. May have been something there. Now, the patch test is a good idea. However, number one, it seems as if the surgery was quite recent. So I would suggest, if that is true, if that is the case, because why do I suggest it's quite recent? The reason is the color of the scar is quite intense red brown, and this area looks as if it's just healed. So it gives me the impression that it's right about less than a year fresh scar, a surgical scar. And if that's the case, I would suggest to wait at least a couple of years. Now, there's two things. I mean, it's kind of difficult to tell whether this is a atrophic or hypertrophic scar. It looks certainly to me very fresh, so I would leave it. So that the area blends in with the surrounding skin, and that should actually happen over time, because normally the scars that are fresh are of a red-brown color, and then over time they start to blend in with the surrounding skin. Now, when that starts, then if we're dealing with hypertrophic scar, then you want to flatten it. Otherwise, you want maybe try to work at the borders. Maybe it really depends. Scars are not. I mean, they've got to be tackled in different ways. And if the scar is flat, then maybe microneedling would be a better option. Very likely. But if it becomes a hypertrophic scar where there's a bump in there, I would actually try to flatten it using voltaic arcing, and then once it's healed, then you could actually go with a micro needling there. So that is my guesstimation. It looks as if it's been occluded there. Maybe this is some scar treatment procedure going on. I'm only using my intuition there, and as again, the area looks quite red. So yeah, I would leave it for now. Certainly leave it. Looks like a fresh scar, and I would leave it because it's gonna blend in more with the surrounding skin. So I would leave it there for a while. So hopefully this clarifies what we would do with this type of scar, and hopefully it's been of help.